friends. My name is Dr. Anubhav Gulati. I am Senior Consultant in Orthopedics and Joint Replacement. Today I will talk about how to make total knee replacement easier for patients. So this is a surgery which is advised for advanced case of osteoarthritis of the knee, and once someone has reached a stage where the pain medicines and the physiotherapy is not working for them, then they have to undergo this surgery. So once a patient or their relative is advised a total knee replacement, the usual emotion is that they tend to become a little tense, apprehensive, and get anxious. So my talk today will help you in reducing this anxiety and will help you undergo this surgery in a safe and controlled manner. So once you have already been advised this surgery, and this happens when your knee joints have become so worn out that they cannot be cured by medications and physiotherapy. So usually this surgery is done for advanced osteoarthritis of the knee. I'll just demonstrate briefly on this model. This is a normal looking knee which has a full cartilage, and a movement takes place normally on this surface. So as we age or we develop some injury, this cartilage tends to become worn out, and then pain starts coming. So initially it can be controlled by medicines and physiotherapy, but unfortunately a few patients will advance to a stage where the cartilage loss is such that they cannot be cured by medicines, and then they become candidates for surgery. So if you have reached a stage where most of the cartilage is lost, then you will have to undergo this surgery to get a long-lasting pain relief. Normally in this surgery, the worn out surfaces are replaced by these metal implants. So one side is metal, the other side is plastic. So it's called a metal on poly arthroplasty equipment. Now coming to the surgery itself. So once this surgery is advised, the usual protocol is to ask the patient to undergo a pre-anesthesia checkup. So this is done to find out if you have any pre-existing illness or if you are fit for this surgery. So this is how the procedure starts. So the patients are asked to see our anesthetist, and they help in finding out if they have any pre-existing illness, how is their general condition, how is their blood pressure, and if they are taking any previous medications. So all this helps in planning of your surgery so that it is carried out safely. So once the anesthetist sees the patient, then they write or prescribe certain tests which have to be undertaken before admission, and this ensures that the patients are safely carried to the surgical procedure. These are some basic tests which have to be done for the patients, and once we have the reports, we can proceed for the surgical procedure itself. The next phase of surgery is admission, and the patients are asked to come for admission. They would want to know how much is the duration of the admission and how long will they have to stay in the hospital. So this question is there in the mind of most of the patients. So in general, a single-sided knee replacement will require 2 to 3 days of stay in the hospital, and a bilateral or a both-side knee replacement usually requires 3 to 4 days of stay in the hospital. Then the next question that usually patients would want to know is, how long will my surgery last? So a single knee replacement usually requires 60 to 90 minutes of surgical time, and if it's a bilateral knee, then it goes up to about 120 to 150 minutes, or 2.5 to 3 hours roughly. Then the next question or the next thought that is disturbing the patient is, how much pain will I have? So trust me, these days, because of the advanced medications and systems, the pain management is very much controlled, there is very minimal pain after this surgery. So there is something called epidural analgesia. So this helps in recovering during the recovering phase. The patients are given epidural medicines from day one itself, and their pain is almost negligible, or on a scale of 1 to 10, it is 1 to 2. Then we also add something called medicated patches, which also help in reducing the pain. And pain-wise, the patients are very, very comfortable, and so pain is very much controlled by modern-day medications. Next, they would want to know when will I start walking? So this question always is asked by our patients. So most of our patients will stand the next day after the surgery, and the second day of surgery will make them walk. So this happens in most of our cases. So when you are in the hospital, you will be walking, you will be able to use toilet. We train you so that you don't have to have difficulties in carrying out daily activities, and the patients usually go home in a walking condition. They are able to carry out their own personal activities of daily living on their own after the discharge. And this is made possible by good use of modern day pain medications. The next question which comes to their mind is, how long will my recovery take? How long will it take for the complete recovery? So the recovery starts once you are in the hospital, you are already mobilized, and then you will be brought back for dressing after a week's time from discharge. And usually after 2 to 3 weeks from surgery, the stitches are removed, and meanwhile the physiotherapy at home is going on. The therapist will help you in mobilization of the knee and making you walk, and at around day 7 to 10, many of the patients they will start climbing stairs also, which is explained to them, so that they do not have problems in going up and down stairs if they are staying in first or second floor. So with these measures, the pain management, the modern ways of handling the pain, the anesthesia, the recovery process which starts right away, all the patients are able to get good results out of this surgical procedure. They don't have to panic. The pain will not cause any trouble to you, and this surgery, which is designed to give you a long-lasting pain relief from knee arthritis, is very helpful, and one should make use of this surgery. We should not get anxious or nervous about undergoing this surgery, and there are modern ways to control all the parameters. Thank you.